Hi, everyone. Welcome tonight. Today we have a great guest. We have Dr. Hela Barhoush. She is a pediatric specialist, and she is here so that she can answer some frequently asked questions about COVID-19, how it relates to us as parents and for our children, and tips on mental, emotional health in this time of social distancing. Dr. Hela, thank you so much for joining us today.
Thank you for having me, Ron.
Yeah, no, I we met briefly a while ago. I have a 2-year-old, so it's not too long ago. But a couple of checkups, you were the one the doctor that saw my daughter Sophia. So I it stuck, and that's why I reached out. You're
No,
very active on social media, so I was really excited that we were able to connect.
yeah, no, thanks for reaching out. And I hope Sophia is doing well. And anything else you need from that end, just let me know. But thank you.
Yeah, thank you. So just to dive into the topics, I know your time is limited. What are some main concerns from parents that you're speaking with right now and during this time of the COVID-19 pandemic?
Sure, sure. So some of the main concerns as a pediatrician, parents come to me when they're concerned that their children may have symptoms, and their main concern is that it's due to coronavirus. And, it's not surprising because when it comes to COVID-19, especially in children, the symptoms can be very vague. So it can be very confusing if your child has a runny nose, itchy eyes, belly pain, whether it's from COVID-19, which is on the forefront of everyone's mind, or allergies or constipation or so many other things that happen in children. So that's one of the main things that I'm hearing a lot from parents.
Hmm.
Um, Another, common concern, especially over time, that I'm getting a lot more of is changes in behavior that we're seeing in children, regression in younger children, and increase in anxiety, mental health issues, changes in mood in children. So, as we're quarantined and at home for longer, disconnected from others for longer, those types of concerns are coming up more and more. And then most recently, I think you have probably heard about this in the news and in the media, but there is a new development that children may be. There may be a connection between COVID-19 and a more serious medical condition that we're calling pediatric multisystem inflammatory syndrome. And so a lot of parents are understandably very concerned and scared about this new development. Since previously we thought kids were mostly spared from
Yeah.
serious and they really had mild disease. And I can talk to you more about that if you'd like.
Yeah. And so tell us about that. Tell us what do we know so far about toddlers and COVID-19?
Sure,
Because
sure.
we've I know so information really evolves so quickly that I wanted to hear your perspective now after all this time that we've had it.
Yeah, that's very true. And, on that note, everything we talk about now can be different days or weeks from now. So I always like to preface things with that
Sure.
in mind. But generally, until now, and really still at this point, we know that when children get COVID-19, all the data shows, both in the US and abroad, that children have mild illness, mild disease. So their symptoms usually are similar, are either they're asymptomatic, which is very possible, but also if they have symptoms, they're very similar to symptoms they would get with any other virus that your child may have experienced in the past. So like cough, congestion, fever. And generally it's very rare for kids to have serious illness end up in the hospital from COVID-19. And that's kind of how we were thinking of it and what all the data has showed until very recently, up until a week or two ago. And most recently, what we started seeing is that there are more and more cases of children developing this kind of new mysterious condition that we're calling pediatric multi-system inflammatory syndrome. And basically, what it is it's taking some features of other serious conditions that we're more familiar with in children. Things like you may have heard of Kawasaki disease or toxic shock syndrome, but it's not exactly that, but it shares some similarities. And what children are exhibiting is it causes this picture of inflammation throughout the body. And the real concern is the inflammation includes inflammation around the heart and the arteries that lead to the heart. And that can lead to very serious issues in children. So so they have the number of symptoms that they develop, and I can go through those symptoms because I think it's so important that parents are aware of these symptoms. So I'll get to that.
Mm-hmm.
And the good news is that mostly children are responding to the treatments that we're providing in the hospital. So if detected early and treatment is provided, children are generally doing well. The other good thing about this is so far it still looks really rare. It's not a common thing that we're seeing. There are the number of cases are increasing and they will likely continue to increase, but really in the big picture and the grand scheme of things, the number still is a low number. So the chances of your child developing this, if they have a COVID-19 infection, is very rare. So I like to reassure parents with that information. And then the third thing that I think is important for parents to know is what to look out for and when to speak to your pediatrician. So whenever basically what this is it's this inflammation that happens in the body, and we're thinking that it looks like it happens as a late effect to a COVID-19 infection or exposure, meaning a child is either exposed to COVID-19, they don't have any symptoms, or they're exposed, they have symptoms, and then a few weeks later, they're saying up to 4 to 6 weeks later, even they start having these symptoms of the syndrome. And the symptoms are as follows. So the first thing is children have to have fever. So that's a requirement. And it's a prolonged fever. So generally fever more than a few days, 4 to 5 days.
Mm.
And then there are a slew of other symptoms that children may have that are similar to Kawasaki disease. So they can have red eyes that look like pink eye, a bright red tongue, and cracked red lips. Kids can get big lymph nodes in the neck, rashes on the hands and feet, and a generalized body rash. So these are the symptoms that are similar to Kawasaki disease. They could have these symptoms. They may not. They may have one or two. That's some one part of it. The other part of it is generally kids with this are pretty sick, so they don't want to drink as much. They're likely going to be lethargic. And one of actually the differences between Kawasaki disease and this is we're seeing a lot of kids with this have belly pain with vomiting and diarrhea, which is one of the differences.
Mm.
So I know this is a lot and it sounds very confusing, but the way I would treat it is first stay calm about it and don't panic because it sounds really scary, but like I said, it is rare. And just to be informed. And if if you have concerns that your child has any symptoms, reach out to your pediatrician right away. So basically, fever for a few days and your child is looking sick, call your pediatrician and they'll guide you as to what to do.
Yeah, and I feel like many of those symptoms are things that already happened to my daughter, for example, right? And yeah, as a parent, it's scary, but reaching out to the pediatrician, making sure that the pediatrician knows what's going on, and for the pediatrician to assure us what to follow and how she progresses or our kids progress. That's something that really helps in the process and make sure that we go through this the right way, right?
Yeah, it's so important. And the beauty of it nowadays is like our group at Riverside and most groups have telemedicine option. So you can do it from the comfort of your home. There's no risk of exposure. And we'll guide you. We'll let you know, hey, is this concerning? And you should do X, Y, and Z, or hey, let's monitor this at home, or I think it's due to this and we can treat with this. So your pediatrician is there for you to help you if you have any concerns. And some parents, I think, have this thinking of, oh, I don't want to bother them because they're busy dealing with more sick kids. And that's not the case. We're here to deal with everything and anything. And so I urge parents to just reach out to your pediatrician with any concerns at all, generally.
Now, should children be wearing face masks?
Yeah. So, the recommendation from the CDC is that everyone, including children over the age of 2, wear a face mask. Um, so a few things about this. You have a 2-year-old, right? So,
The
so
challenge.
the why we start at 2 is because wearing a mask can be a suffocation hazard in a young child. So, Obviously, if something is covering the nose and mouth and they don't know how to remove it, then that's a risk. And we do not want young kids under the age of 2 or babies wearing masks. I've had a lot of parents recently asking me, can I have my newborn, my infant wear a mask? And the answer is no, that's a huge risk. So under the age of 2, they shouldn't be wearing a mask. It's recommended they wear it if they can over the age of 2, but in real life, that's not an easy thing to do. I have a 2.5-year-old as well. I tried putting a mask on him and it didn't end well. So, what I tell parents is, work with them, make it do it at home, make it a game, make it fun, decorate it, put it on their favorite stuffed animal, and try to do it and see if they take to it. And some kids may, and other kids won't, and they'll fight it. And if you have a child that's fighting it, or if they're wearing it and they're constantly like putting their hands to their mouth and taking it off, that actually can cause more harm than good because it's exposing germs from their hands to their mouth and vice versa. So, if your child is in this group, which a lot of kids are, then I say don't force it. I think the best way to go about it is, to the extent possible, try to avoid taking your children that are in this young age group in places where it's difficult to practice social distancing. So like keep them out of a grocery store or a pharmacy or even like a crowded site or something if you can. But don't force the mask wearing. But definitely for older kids who understand and are capable of wearing it, they should be wearing a mask. And wearing masks, again, is in places where it's difficult to social distance. So if you're in like your backyard or in a private area or in an open neighborhood, not necessary to wear a mask. But if you're somewhere where you're within 6 feet of others, and especially for like a prolonged period of time, mask wearing is a very good way to reduce the risk of transmission, both from the person wearing the mask to others and vice versa.
Yeah, I hear you. And there's also, besides the kids getting sick, is the social distancing from their elderly, right? So, my mom, she lives 5 blocks away from here, but it's tough. I mean, we prefer not to keep our distance because we don't know if we catch it, if my daughter Sophia catches it, and we don't want to jeopardize grandma, right? So
Yes.
I feel you on that end.
Yeah, around we're going through the same thing. My parents are actually both good, and
Oh,
I think it's been one of the hardest things of this pandemic, and for the elderly just being disconnected from family and from their grandkids, which brings them so much happiness, as we know. And it is a really difficult situation because you're right, we don't want to put them at risk, and um, it's so hard to know whether you have it, whether you've been exposed. There's just really not a good way to be 100% in the clear at this point.
hmm
So I, encourage parents, and I'm sure everyone's doing this, but connect with them through digitally, through screens, and do what you can to maintain communication and connection in other realms. And I'm hopeful that over time, we'll find a way to, connect in person with our loved ones. But that's definitely one of the hardest parts about this for me, and I think so many others.
Yeah, and going back to the, sorry, I'm hearing a bit of typing in the background. Um,
Not
not sure, but hey, mhm. Well, so how is the situation affecting kids' mental health? You mentioned it earlier, and what are some of the tips that you give parents? Like, what are some signs that we should be looking out for? And then what are some tips on what we could do about that?
Yeah. So this has affected everyone's mental health, right? Like we had such an abrupt change in our routine and our day to day, and that's not easy for anyone, especially children. So
Mm,
they're all of a sudden being disconnected from their peers, from their grandparents and family, and all of a sudden their routine of going to school and doing their extracurricular activities, everything has been taken away from them, and that's a huge change for kids. And and so we are seeing those effects, and as time goes on and this quarantine and pandemic is there's more time, we're seeing it more and more. And so and it can manifest in different ways in different children and in different age groups. So
mm,
like in younger kids, toddlers, for example, we're seeing a lot of kids with regression, like um, all of a sudden they want a passy, or they're having tantrums like they did a year ago that they grew out of. So you can see a lot of aggression. A lot of kids can see this behavioral problems, acting out, being more defiant. And then a lot of kids, obviously, we have a big increase in mental health issues, anxiety, mood changes, sadness, depression.
Mm.
Um, so this is a real problem. We're seeing it more and more. And as a pediatrician, it's something I'm really dealing with on a daily basis. I think probably 25% of my patients are due to this
Oh, wow.
syndrome of this problem. Yeah, it's a big issue. And so, ways to deal with it, there are a few. I think trying, especially for younger kids, but really for all kids, routine is good for them. They thrive on
Mm.
routine and knowing what to expect.
Mm.
So it doesn't have to be strict, because we all know how difficult, everyone's wearing a million hats and juggling a million things, and having a strict routine is not easy. But just a loose routine of how the day will go, I think is helpful, because then children know what's coming next. So I urge parents to do that. The second thing is trying to stay connected with your children and engage with them. So, there's a lot of increase in screen time, both like for school and for connecting with people, but also parents are a lot of times working from home, and that means their kids are on
Yeah.
screens more. And I tell parents, I get it, like you have to do what you have to do, but try to break that screen time up with real in-person engaging activities. So do puzzles together. Take your kids outside for walks and talk to them, especially older kids. Understand what they're thinking. And especially for older kids, they should know that they come to you with any questions about what's going on, and that they don't get their information from outside sources, because then
Yes.
you don't control what they're hearing, and that just causes more anxiety and more fear. So there should be an open channel of communication and engagement between parents and their children. Um, I think that's helpful. I think, to the extent possible, it's important to practice social distancing and wear a mask and hand wash and all these things. But getting outside, getting energy out, getting fresh air is also important. So try to do that as well. Those are the main things. Yeah.
Yeah.
Connecting. One thing is just, we mentioned this before, but using screen time productively and connecting with loved ones, family, play dates, so even kids their own age, just so they have that connection that we're missing out on in real life.
I think the connection with other kids is something that I have to work more as a parent. We do have like a class that we do during the week, but that's only 1 hour, one day. So we do have a lot of screen time with family members, more than we've ever had before, and I'm sure that that happens to a lot of people right now as we try to deal with this. My daughter does come up to me pretty often during the day with a book and kind of like, all right, take a break, come and read to me, and
Exactly.
then you can get back to it. So those are really great tips. Thank you so much. And just to uh, just wrap up, should people be getting antibody testing? What's the benefit? Because we've been hearing a lot about this, but I wanted to see what your perspective was. I know it has been done with both for the parents and for the child. I've heard sometimes, so I wanted to hear your perspective.
Sure. So yeah, so this is a very common question. Actually, I'm getting probably one of the top ones, going back to your first question. So antibody testing, it's a bit of a tricky conversation, because there are a lot of tests on the market. There's a lot of tests out there, and some tests are better than others, because what happened is the FDA dropped their regulations and allowed companies to just make the tests as fast as they could, and they didn't go through the validating process of the test. So there's a lot of tests out there that aren't accurate or reliable. So that's the first issue. So when it comes to doing the test, if you're going to do it, you want to make sure you know what test you're getting, and you want to speak to your doctor about how comfortable they feel with the accuracy, and we call it the specificity, sensitivity of that specific test. That's the first issue. The second issue is whenever you get an antibody test and you get the result, if your antibody is positive, so your IgG level, that's the antibody that is a long-term antibody that stays in the body after you've been exposed to an infection. So if that's positive, the question then is, what do we do with that information? Because at this point, we just don't have enough data to know whether a positive IgG test means that you have immunity to the virus, so that if you're out and you're exposed again, you're not going to get it. And eventually we'll have that information, but we don't have it yet. And my fear is that we have positive tests, and that gives us this false sense of reassurance that we can go out and live our lives more normally and drop the social distancing and the mask wearing and all those things we're doing that are working and protecting us. So I think, and if you get the test, interpreting it is an issue, and I wouldn't change my behavior based results. So that's an important thing. The third thing when it comes to antibody testing is, I lost my train of thought from my third point. So yeah, sorry, it's for the timing of the antibody test, right? So it takes our bodies about anywhere from 2 to 6 weeks to develop antibodies after we've been exposed to a virus. So you want to make sure you're doing the test. I like to wait till 3 to 4 weeks after exposure or after the end of your symptoms if you had symptoms of the infection. And so you want to make sure you get the timing right, because if you do it too early, it's going to be meaningless because it's probably not going to detect it, but that doesn't mean necessarily you weren't exposed or you didn't have an infection.
Is there such thing as it being too late? Like
So
too
that's
later
the
into
thing.
the after?
Part of not knowing the data is we know that in the short term, when we compare it to other viruses, there's a period of time that's usually anywhere from 6 to 12, 15 months that we have antibodies that are active, but at some point those antibodies fade over time. We don't know, because this is so new, how long that period of time is. So at some point, yeah, those antibodies will go, but we don't know when is the answer to that. And then the last thing is when it comes to making this decision with all this information that I just told you, you're probably thinking, okay, so why am I doing this test? Like, how is it going to change anything? And that's true when it comes to you personally. But the test, the reason why we want people to do it and why it's helpful is because it's helpful for more of a public health, broader viewpoint. Because if we have a better understanding of how many people have had this infection, then we can understand the actual real mortality rates. We can understand the actual numbers in communities of how many people were affected in communities. And that information from a public health measure can be really useful. And then, personally, I think over time we will learn more. So maybe a month or 2 months from now, the meaning will be different than what it is now. So it could be helpful in that sense. But really at this time, I would, tread with caution when it comes to doing these tests.
Okay, thank you very much, Dr. Hela. I think we made a good time, and you had so many great points and information. So thank you so much. I'll tag you so that you have this video as well, and I'll talk to you soon.
Thank you so much, Ron. Great seeing
Thank
you
you.
again. Say hi to Sophia.
Will do. Thank you.